there's a chlorine shortage for pools right now, so maybe there'll be a saline shortage too.
A what shortage?
We never took out LR off of our squads to begin with. I mean, we've always had it.
Nice. Chlorine shortage. If you have a swimming pool, you better go buy chlorine.
It's because of a fire down in Louisiana.
I got mine.
Excuse me, Chief Elliott. I have hit the record button and you are now streaming on YouTube.
Okay. Well, it is 2 o'clock, 2:03, so we're going to call the meeting to order. Write that down. And I did take attendance, and we do have a quorum, so I appreciate everybody being in here today. I'm sure there'll be other folks jumping in as the meeting goes along, so appreciate everybody joining us today. Let me see here. We really don't have any type of education presentation this time around. I'm hoping we could start live meetings again, maybe at the end of summer, beginning of fall, and we can start off our community, our education, and get some start working on that. So we don't have anything right now. For the chair report, I really don't have anything special to report. The only thing I will add that really doesn't come into any of the committees or up agencies is the Cuyahoga County Fire Chiefs and the Board of Health are currently working on our homebound vaccination program. We did a couple pilots with this program over the last 3-4 weeks or so, and we're about ready to roll out a program so we can actually get into some of our homebound folks in our community. It's not going to be one of those programs where people have to participate in it. We're hoping that the chiefs in those municipalities will want to participate and offer that service for their residents in their communities. So there is going to be some further discussions this week. Chief Sweeney from the Cuyahoga County Fire Chiefs Association sent out a meeting agenda to kind of talk about the program a little bit more. So that's good. That's good news. And that's all I really have to do with the chair report. There is no public comment shown. I would like to get our minutes approved from our March 8th meeting. We did have a quorum at that meeting. We had a fairly quick but productive meeting. So if there's anybody that would like to make a motion to accept the minutes that I sent out from the March 8th meeting, I would appreciate it. Anyone? Bob, you're always good for one. Thanks. Can I get a second?
Second.
Thank you, Tom. Anybody opposed or any changes to the minutes, please let me know. If I don't hear anything, we'll approve those minutes. All right, those minutes are approved. We're going to go on to our reports from our Cuyahoga County agencies. The first up would be the Office of Emergency Management. I know we have Adam here. Adam, if you could give a report, please. Adam, you with us? All right, we'll go to grants. I believe I saw Leslie on. Leslie, do you have anything to offer or to pass along with the grants division?
Sure. The project that I was aware of, we were purchasing replacement supplies for the MCI trailer, and that project is completed and the supplies were shipped. And then there was sort of the piggyback off of that for the hemostatic dressing. Hopefully I said that right. Linda had told me last week that that bid closed and she got enough bids, and I believe she was going to reach out to you as the project owner, Bruce, to make sure that what was actually bid this time is what we need to get. So we're getting close on that one as well. I don't think you guys have any other open projects with us at this time. Correct me if I'm wrong, but I thought that it was just those two.
Yes, you're right. I would like to discuss with the group a little bit of what happened. So when we initially requested and bid on the project, the winning and the lowest bid sent us regular Kerlex cling, you know, for the hemostatic dressing. And obviously, that's not what the definition of a hemostatic dressing is. So we had to go back to bid. So county grants did put it out. So last week, I did receive an email back. There were 4 bids. 3 of them were the quick clot, which were most of us are familiar with. The 4th bid and the lowest bid was an Israeli dressing. I don't know if, you know, maybe some of you folks have maybe worked with this Israeli dressing. It's basically like an ace bandage, if you will, that has a pad on it with a device that tightens it up. It was a considerably less than the quick clot that the other agencies bid on. I did not feel that met the definition of a hemostatic dressing. I consider that more of a bleeding control dressing, not you know, like a wrap or, you know, kind of like a tourniqueted type of device. So I asked them not to accept that bid and go with the next lowest bidder, which was a quick clot, which we are all familiar with. The last I heard that they were going to send that down to, I guess, the state EMA to see if it was approved. So I'm really hoping it was, because I'm not sure that we would really have a whole lot of use for the Israeli type dressing. Are you aware of that, Leslie?
So that is the next step. We usually, so once you approve or whoever the designated project owner approves, then yes, it goes down to Ohio EMA to review the bids. I don't recall that one coming back yet. So I'll be on the lookout for that, and, you know, of course we'll let you know. And then just other grants, things that we have found out from the state that we think the 2021 state homeland, the notice to us will come from the state in June. And then, you know, we'll get the committees, and we'll have to meet on their respective projects or ideas of projects and prioritize them, and then they'll go to CCESAB, you know, for the normal process. Trying to think if there was anything else at this time.
I know you won't know the answer for this, but I mean, in round ballpark numbers, would you expect maybe like under $1 million total for 2021 state homeland?
Oh, I'm sure. Yeah, we haven't been.
Yeah.
It's gone down, I think, the past 2 years. So yeah, it'll definitely be under.
Okay. And just so the committee is aware, that would have to, is that going to be mostly for all of Region 2? So that's Lake, Geauga, Ashtabula, and Lorain County?
Yes.
Okay. So in a nutshell, even if we did receive some funding, it's spread out pretty thin across surrounding counties, and it's pretty, it's well, a lot of people are going for things, so sometimes it's very difficult to get items approved unless they're really meet the terms of terrorism or those types of things. So, but if we do have some projects for EMS, We probably should start thinking about them now. So when we do get that announcement in June, that we could be ready to jump on it. So start thinking about some things we might be able to do, and if we get enough interest and it meets the means of the grant, we can move forward on that. Anything else, Leslie, to report?
No, that sounds perfect. If you guys, start thinking about your projects, that'll just make it all the easier in June.
Anybody have any questions for Leslie? All right, thanks, Leslie. I did see Nicole today. Nicole, do you have anything, or Dr. Collins, for Cleveland MS, Cleveland Airport, anything with Cleveland?
I can't speak on behalf of Cleveland Airport, but I can speak on behalf of Cleveland EMS and the Department of Public Safety. So where we finally switched over to the county protocols, and we're up to date on the 2021 version. As we did the transition, we're monitoring individuals and underperformance improvement to make sure they're adhering to the protocol. Also, I noticed you were talking about doing the homebound individuals for vaccinations. So we have been assisting, obviously, this entire year, CDPH with vaccinating individuals. We did some pilot programs. We call them our little vendor trucks, we call them, as we got into individuals' homes. And this week, actually, CDPH is going into individuals' homes with the nursing staff, and we are assisting them with other pods at this point. Dr. Collins, I don't know if you had anything else to add.
No, I think most of the discussion we had earlier on the protocol committee will be summarized later. So
Thanks,
I just
guys.
real quick, Commissioner, appreciate your efforts getting everybody transitioned over to the new protocols. I'll share with this group. I was really expecting it to be a pretty heavy lift on behalf of the leadership at EMS. And kudos to not only Commissioner, but her staff and the personnel for really switching to these protocols as I think painlessly as possible.
And just to add to that too, Doc, many members of Cleveland AMS have been very vocal and participating in protocols and assisting us with changes and looking through them to fine tooth comb and doing those types of things. So they've been involved for several years now in the process, and so we're very glad to have them finally aboard, and their help in the protocol committee is very much appreciated. So good job by everybody.
Yeah, and maybe we should just maybe we should just
Thank you.
take a moment and recognize the fact that we're sitting here in this meeting and all of us are on a regional EMS protocol now. And for so long, no one ever thought that would actually happen. And it was this group that really provided a lot of the horsepower behind the initial movement and a lot of effort from a lot of people. But it's pretty amazing that we've gotten all of Northeast Ohio on a common EMS protocol. So good job, everybody. Give yourself a pat on the back.
We just found out today too that Lake Health will be switching over to the regional protocol as well in a short amount of time. For those that are not aware, Lake Hospital Systems was purchased by UH or taken over by UH. I'm not sure how that all went, but they will be using the regional protocol. So like Dr. Collins says, we are really starting to expand and being used outside Cuyahoga County. And that's kind of one of the reasons why I really wasn't in favor of calling it a county protocol, more of a regional protocol, because really want it to be a regional approach here. And I think you'd have better buy-in by calling it a region instead of county. So, so that's been all good news, and we continue to have those talks. And Jackie will give a little report on the regional protocol later in this update. So thanks for that. Bill Davis, are you on by chance? Steve Davis?
And Bruce, I have one more thing to add.
Yeah, sure.
We actually, today we're doing training for Auto Pulse. The city was able to purchase Auto Pulses for the majority of our ambulances. So after we're doing the train the trainer now as we speak. So hopefully we'll start rolling those out after we do train the trainer over the next 4 to 6 weeks. We're shy a few for all the frontline trucks, but we'll hopefully be able to purchase those out of the operating budget where we'll have them on all the frontline vehicles. So
Awesome.
COVID grants for our billing section, we were able to get those, and we'll be getting those on the truck soon.
Good work. That's great. Any questions for Dr. Collins, Commissioner Carlton, or anybody else with Cleveland? All right, thanks. We're going to move on down to Center for Health Affairs. I did see Andrea Bishop, if you're on.
Yeah, hi, can you hear me?
Yes, you can.
Okay. I just want to give you a little bit of update. The hospital numbers, as far as COVID goes, they've been kind of staying pretty steady and have seen a slow, steady downtrend. So the hospitals have been working really hard on the vaccine front as well. They've seen a lot of people, the slowdown of the signups to get vaccinated. So their supplies had increased. So they're doing multiple prong approaches to kind of like decreasing the shipments that are coming from the state, and they're consolidating their clinics, vaccine clinics, to a little bit more focused ones in that. So we're working hard on the vaccines. I did hear in the zone call this morning that this is week 9 for the Wilstein, and apparently they're going to be offering J&J tomorrow, this week, and then next week they're going to be doing second dose. Week 10 and week 11 they're doing second dose Pfizer's again. So it's on the vaccine front. We had our monthly coalition meeting last Friday on May 7th. We had Mike Jones from Metro Health Medical Center spoke on supply chain preparation and things that they had done at Metro Health since the start of the pandemic to try to ensure that they had enough supplies for their caregivers during the event. So that went really well. It was well received. Thank you to Metro for stepping up and providing the speaker. We had our table, as you recall, we had our burn surge plan that had to be developed last fall, and we tested it in tabletop in May and subsequently updated the burn surge annex, which is a regional approach. The executive committee from the coalition approved it last Friday, so Beth's on vacation. So after she gets back and gives it her final blessing, make sure I crossed every T. We'll be posting it on our coalition website. The thought of the burn surge annex was to try to incorporate it in with your regular mass casualty plans. And I know we worked with the team at Metro Health to develop the draft annex, and the protocol that you guys have, I referenced that, and it's a lot of good information there. I really appreciate that. So that was helpful for me, and as we started to develop this regional annex. So just Bruce, when you pull your team together to review the MCI plan, just know that the annex is there, and I don't know if there's anything that y'all need to add to it, but just for consideration, because the hope is to give some kind of a source that if there was a mass casualty incident that occurred in our region, every county obviously locally would respond like they locally respond, but you might want to consider incorporating some of the stuff that was brought as far as communication and that was included in the regional annex. We are currently doing one of our requirements for our grant from ASPR is to have redundant communication drills. I'm sure you have them in your organization. We have to have one for the whole coalition. So it's been a challenge. I think it's been over the last 4 years trying to figure out a way that had one mode and then a second mode of communication and how many people confirmed. So this test today we're actually using our website as the first mode, and then we have like a real simple survey monkey that's 3 questions long. for people to respond to see if that would be a viable mode of communication that we could use region-wide in the event. And then I think finally, one of the things that I'm trying to keep ahead of everybody is the patient tracking system. During the tabletop, there really kind of became evident that we really need to make sure that that stays on the forefront. And it's not used on a daily basis, so there's lots of challenges there. And it was pushed out as a facility administrator during the training program. So I developed a concept to try to have every county do an OH track drill twice a year, maybe a month. And we started last month in April, and CCOMS created the incident, and then we had it open for 3 days for people to practice and add their patients into it to make sure that they got access and can put a patient in. So I just wanted to start developing some kind of like a muscle memory that we're going to have these drills twice a year. So if you have time, you might want to incorporate testing your departments during one of these drills. Tomorrow, Gadaha area is doing a training online, so I'm going to watch theirs to see what they do as far as trying to keep their members trained on the system. There is a lot of training tools that are on the website, but I'm just going to watch that training tomorrow to see if we can get any ideas to try to keep that on the forefront. So I think that concludes my report.
Thank you. I don't know if this is a question for you or Adam if he's on, or whoever from the county. So the burn surge annex that was developed and going to be approved by Beth here soon, is that actually going to be, you said that's going to be, I know, where's that going to be based at? Is it going to be literally combined with the MCI plan, or is it going to have its own house, you know, if you will, its own little location, or is it going to be embedded in the MCI plan?
It's an annex to the Coalition Hospital and Healthcare Regional Plan. So that's an annex to that. So your county MCI plan just should look at it to see if there's any pieces in the regional plan that you think would be helpful. Because we had in the tabletop, we had 300 burn victims at the scene of the explosions. So there had to be a way to try to figure out prioritization. You know, obviously your triage on scene is going to happen according to your local plans. You're going to be doing a casual collection point and triaging people, and you're going to take them to the hospitals as you can. And once they get at the hospitals, because there's limited burn beds at Metro Health, they're obviously burn victims are trauma patients first, so then they would be taken to the trauma centers, and then from there in the plan it kind of discusses ways that they would coordinate and identify the ways that the patients that would need burn specific beds with the hospital shifting around. So there's a lot of coordination involved. And Metro Health is, we have 2 burn coordination centers that have been identified in the state, because the state has a burn surge plan, because it's such a specialty care area. So Metro Health obviously is like the upper half of the state, and OSU is for the lower half, and then they would assist with the patient distribution once they've left the scene, and how to best, you know, and then call on the region assets like Michigan and Minnesota.
Okay. So it's not necessarily going to be in the county annex. It's more in the hospital annex and how to deal. So we won't necessarily see that being rolled out into the annex of the county update then, correct?
No, the coalition, the 4 core agencies in the coalition are hospitals, EMS, EMA, and public health. So they're all really part of our coalition. So the plan applies to all of the coalition members. Okay, as well as, and then we have the core members, which are our nursing homes and dialysis and all those other non-hospital healthcare providers. So these coalition plans kind of try to address the different roles and responsibilities of each of the core members and the other agency non-hospital types. So the thought is that we have this coalition plan that each county would just kind of take a look at it, and you might want to incorporate pieces of that into your MCI plan.
Okay. Thank you, Andrea.
That makes sense?
Yeah. I need to touch base with you tomorrow anyways, if you're going to be around, and I got some things to run past you on a side note. So, but I thank you for your report. And does anybody have any questions for Andrea? All right, great. Thank you.
You know, Chief, I wanted to put a plug in for the airport. I see Chief Davis isn't tuned in today. They're having their big disaster drill at Burke Airport on September 21st. And they described 3 dynamic situations. They're really going to be reaching out to all of us to help. I'm sure there will be much more to follow. So just to keep.
I like those slippers.
What was that?
Oh, I'm in a meeting.
All right, sorry about that.
Happy Mother's Day.
Sorry about that, Chief.
No problem.
Okay, so that was September 21st at the airport. They're going to have their drill. I'm sure we'll be getting more information out on there for assistance. But thank you, Jackie, for that little plug there. And we'll be looking forward to more information on that drill. And hopefully we could utilize some of the patient tracking that Andrea spoke of at that drill, and you know, work on some of the MCI stuff and really get back into doing those types of things again. We had a whole year off of that, so it'll be nice to get back at it again.
I know that was one of their goals. They also have a new kind of a family collection center for large amounts of travelers. And I know they really wanted to test a surge into the airport's ability to manage a lot of, you know, non-acute type situations or patients as well. So yeah, they got a lot of things underway.
Okay, awesome. Look forward to working with them and actually meeting their new chief too. I haven't had a chance to meet him, so it'd be good to work with them on their plan. So thanks for that report. I see Rebecca is on today. We haven't had the pleasures of having Rebecca on for some time. I guess she's been a little bit busy with things. So we're glad to have Rebecca on today. If Rebecca, if you want to give us a report, that'd be great.
Hey everybody. I don't have a whole lot to say other than, you know, it seems like our cases are starting to level off and slightly decrease, as well as our testing positivity rates. So that's a good sign. I think it shows, you know, vaccinations are certainly helping. We are still seeing about 216 per 100,000 cases of COVID in our county. So that still keeps us in that red category. And, you know, depending on how things go, we'll probably stay there for at least several more weeks at a minimum. We've vaccinated over 55,000 people, and we continue to do smaller vaccination clinics with a focus on our communities where that may have issues regarding access to vaccine. And so those clinics are being scheduled into June. And I guess that's pretty much it. You know, we're getting a welcome reprieve, but I know we are still having cases reported, just it's decreasing. So I do see Heidi is on. I didn't know if she wanted to add anything.
Heidi, you have anything you'd like to say? I guess not. Thank you very much, Rebecca, for all your work and working with the county chief and all the EMS partners over the last 12 months. I know it's been very challenging for all of us, including you. And it's been anytime we've ever had a call, you've always been answering our texts or calls and really helping out our folks. So I appreciate everything you have done for us and continue to do, and look forward to the next part of this, doing homebound and hopefully we can get back to normal before you know it. So does anybody have any questions that they would like to ask Rebecca while we have her on?
Hey, Bruce, Ken Ledford, I have a question.
Okay.
I don't know if this is for the hospitals or the Board of Health. We are now starting to see patients that had COVID 3-4 months ago, and we are now transporting them a second time, and we're being notified that the patient is testing COVID positive. And then when I checked with the person notifying me, they're telling me that, yes, they tested positive, but they are not contagious. So my question is, are we adding these numbers to COVID cases, even though they're already over the virus? Thank you.
So you're asking if they're being counted as a new case? So they've had it, it went away, and then they tested positive again?
Correct. And then the nurse told me that they can test positive for up to three months, but they are not contagious. So my question is, are these being added to the daily numbers as positive cases again, even though they had it 3 months ago and they've survived the virus, but because they have the antibodies or whatever you guys are testing for, it's still showing up that they're positive?
Yeah, you know what? I don't know the answer to that question, Chief Ledford. But I can ask and get back to the group.
I was under the impression that repetitive positive tests on a known recent COVID patient were not being counted as new cases. Now we are getting into the issue of people that have had COVID 4, 5, 6 months ago that are now getting it again. And of course, these cases are very mild, and they may not even get to the attention of EMS or the inpatient settings in the hospitals. But we are seeing repeat cases of COVID. We are seeing patients that have had COVID vaccinations that are having mild cases of COVID. And that's to be expected. Not every vaccine is an absolute rock solid 100% effective rate. And with this many people being vaccinated, it's not surprising that a few are getting COVID down the road. But as far as how those repeat COVID patients are being counted, I would think they were being counted as new cases.
Okay, thank you for the update. And if there's any other updates on it, I'd like to know how to proceed. I mean, like I said, I was told the lady had it in January. She does not have it now, but she tested positive, and they notified us that she tested positive, but she was not contagious. That's what they told me.
All right, Chief. Rebecca will follow up with that a little bit and maybe be able to provide you some more concrete information on that moving forward. So thanks for the question. Is there any other questions for Rebecca? All right, great. Thank you, Rebecca. We're gonna move on. We're gonna move on to CCOMs. Jackie Costa, do you have any CCOMs update?
Yeah, couple. First thing is the East Cleveland transition is complete. So East Cleveland is now live back with their own in-house dispatchers. So that was, everything tested good as of Monday. So for East Cleveland now, you can call over to the police station directly if you need any assistance, 216-451-1234. As Andrea stated earlier, we did participate in the regional track drill last month. We had a couple of errors here on our end, which have since been released. I had some newer people doing the alert, so gave a good opportunity for training and for me to address some things that maybe were missing. We are desperately hiring call takers. If you know anybody that would be an excellent 911 call taker, please send them our way. I plan on us participating in the airport drill just as we have in the past. And that's really the only thing I have for CCOMs wise. When you get to the drill, I can do that unless you want me to address that now. Or I'm sorry, the protocol, unless you want me to address that now as well.
I just got a question. So as of today, are you guys doing any kind of dispatching for anybody?
No, we're back to our 911 call taking and the other things that we did, but we're no longer doing police, fire, or EMS dispatch. We are backup EMD for some agencies, which basically just means like if one of the smaller PSAPs and maybe only has 1 or 2 dispatchers on duty, you know, if you had a CPR patient and you had an MOU with us here at CCOMS, then your dispatcher could send that call back to us so we could do the CPR instructions while your dispatcher handles actually dispatching out units and the other things that they have to do. So if any smaller agency is interested in that, please reach out to me. That does require an MOU.
So you guys can still do everything else from MAVIS notifications to starting an OH track and for that request and all those other jobs you guys are still doing. You're just not doing any 24/7 dispatching, correct?
That is correct. Okay. And we're also in the middle of the 911 wireless calls that we're going to Cleveland. Those are going to start coming back here over the next month or so.
Okay. Any CCOMs related questions for Jackie? Why don't you go ahead and give us a protocol update since you got your mic live.
Okay. So we had an excellent meeting today. We're getting really good feedback from our medics in the field, so I definitely want to encourage them to keep doing that, looking over that protocol, come out, you know, let us know if you find anything. You know, we're going everything from typos to some other changes, things like that. So we recommend that they continue to send us feedback. There was, I think you were talking about it briefly earlier, there is going to be an informational document that's going to be going out regarding ketamine. Dr. Collins and our group has taken time out to really kind of get some informational document together for you on that. Right now we are meeting every other month. So right now we're piggybacking our protocol meetings with the EMS subcommittee meeting. And then in October, we will start having monthly meetings as we prepare for our 2022 revision, which will go out January 2022. And just really the only other thing that I wanted to mention, and Dr. Collins can add to it if he wishes, but I have actually recently received some requests from other agencies, either throughout the country or even here in Ohio, that our protocol, people are just loving our protocol and the way that we have it put together and the collaboration and all of that. So I have been getting quite a few requests for other agencies to utilize our framework to develop their own. So good showing of this amazing project that so many people have taken part of, and it's really been quite a success in my opinion.
It really has, and I'm proud to be part of it. I just want to throw a couple things out there, and Dr. Collins, may, feel free to speak up. So we're still, just to make sure everybody's clear, we're still operating on our COVID protocols that we came up with last April, I guess. We haven't officially taken them down, so hopefully your agencies are still doing all the COVID precautions that that we implemented back then. You will be seeing, as Jackie said, there will be a document coming out. I'm going to send it out through the ESF4 desk, but I'll also make sure I get it out to the county fire chiefs on another email too. So just to kind of piggyback on something. So it is the intentions of the protocol committee to only update the protocol once a year. And Jackie even mentioned October will be meeting every month, and any kind of typos and those types of things, minor things, we've been working on them from day one, getting them ready for a January rollout. If there's something that we feel is a safety, like I say, the doctors feel like it's a safety concern, that needs to be done immediately, we have to have the authority to do that. And the document that's coming out today or tomorrow is that indeed. So there will be a document coming out to make an amendment to the protocol for ketamine. So right now the protocol says you could do a repeat for ketamine for agitated, delirium type excited people every 2 minutes, and they wanted to change that to 5 minutes. So you will see that coming out, going from 2 to 5 in the new revision. So that's going to take place basically immediately as soon as the documents come out. All the other little changes are going to take place in January of 2022, as Jackie said. So we're planning. We already got a handful of things that will be on that rollout in January. Dr. Collins, do you have anything you'd like to add in those regards?
I'll just reinforce about the COVID protocol, that we still are encouraging mask use in the stations. And if I can take over the screen for a second, Bruce, if I can show you some results. We surveyed the metropolitan medical directors across the country, and I can show you the results of that real quick.
The county has, I think, full control of that. So county EMA, if you're able to share the screen, there you go.
Okay. So we got stuff from Milan, Italy, Columbus, Colorado, FDNY, San Jose, St. Louis, Dallas, Chicago, Honolulu, Orlando, Seattle. So that's where we've had replies from. And of the 30 replies, 60% say that everyone is required to wear a mask in station. 20% are encouraged to wear a mask in station. And 16%, 5 agencies say that if everybody on the shift is vaccinated, mask wearing is optional. So for the most part, everybody is where we are right now, and that everybody is required to wear a mask at all times. So we are consistent with what is going on nationally.
Dr. Collins, can you just explain to the group real briefly when somebody calls to use our protocol, what the intentions of our committee is in allowing that?
Well, our protocol is a public document, and so we don't have a lot of opportunity to prevent someone from using it, but we do ask that any agency that requests our protocol do 2 things. One, they take responsibility for any updates to the protocol down the road. They should not expect this group to be notifying areas outside of our current area about any changes in the protocol. And 2, we ask them to give credit to all the people that worked on this, the protocol committee and the agencies involved. As all of you know, EMS protocols across the country they go through a lot of R&D, rip off and duplication. So it's the highest form of flattery when someone wants to use your protocol. But as you all participate in, we do a lot. We put our protocol under a microscope all the time, and we look for ways for making it better. And it would be totally impossible for us to notify everybody that's ever requested our protocol about updates. And so they need to have their eye on keeping their protocol up to date.
That's great. I would say there's been one good thing with COVID, which there really hasn't been. I think it's been the collaboration and the weekly huddles that we've been having, and for a while the daily huddles, and then every third day for the last year. And it really has got all these different hospital systems on the same page. And now that we're doing the protocol update, it's just kind of like we're all on one big system. There really is very little, my system's doing this and my system says this. And it's I think, just working through some of these things that we've worked through over the last few years from RNC to from NOTS to now COVID, it really allowed us to work together a little bit better than what we may have had, 10, 15 years ago. And I like where we're at right now with everything. And the way we're moving forward on some things is really encouraging that this is going to be around for a while. And, it will keep growing, and doctors have been committed to this whole process from the beginning, and we appreciate that. And now we can actually see that, the end product is, is what we intended it to be a few years ago. So appreciate everything that you guys have done, and Jackie, in making this what it is. So we'll continue to meet and make the product better and better, and look for a rollout in January of 22, and we'll look for this ketamine update in the next couple of days. So does anybody have any questions for Jackie, Dr. Collins, anything about the protocol? Awesome. Thanks, guys. We're going to switch gears a little bit, talk to some of our hospital partners. I'd like to have Todd Baker speak a minute about NOTS. I know he has some things he'd like to share, I'm sure, about the symposium.
Yeah, thanks, Chief. Our symposium is November 9th this year from 7 to 3:30. It's going to be virtual again, and I know people that I've gotten feedback already that people are upset about the virtual. I will tell you, when you're working with the convention center downtown or whatever, Lake Huntington, there's a lot of financial commitments that we had to make that we still weren't necessarily able to answer questions on. So this year, instead of potentially giving away a lot of money and not being able to do it, we're going to do it virtually again. You can register online probably in the next month or so. We're going to start trying to get save the date information out. We do have a guidebook app now that if you've been to the symposium before, you probably got an email. It's an app you can download on your phone that has NOTS information. It's got some CE stuff. There's some violence prevention stuff. There's links to videos from last year's symposium. So if anybody missed it, I know we had a lot of requests for Dr. Christian Heim, who did the basically the talk on PTSD for healthcare workers. So that information's all available. The other thing is we're working right now on, I'm actually working right now on educational piece for PTSD. I think, as many of the healthcare professionals predicted, a lot of times we don't see some of the mental health in our own staff during the height of the stressors. It's after the fact. I know for me, I'm taking it a little bit personal because we had 2 firefighters in the month of April take their lives in Lake County, one retired and one active. So I'm going to put together some education I'll make available to anybody that wants it, with just kind of a PTSD education, things that we can do to take care of ourselves, each other, And then the other big thing is I think that reference stuff. OAPFF has their peer support. There's the SOL program, there's Ohio Assist, there's the local CISM programs, but just in talking to some mental health professionals last week, I think now's the time maybe to get out in front of people and just make sure that we're addressing that, or at least trying to destigmatize it. And other than that, if anybody has any and the one call system. The one call system's moving forward. Actually, Jackie and I kind of played email tag here a little bit. Jackie, I apologize. I got behind because one of those folks that took their life was associated with my department. But we're going to set up a time to tour CCOMs. We have the vendor selected. It'll be a topic at the NOTS board. I think Commissioner Carlton's involved with that, so she knows that some of the conversation that's going on. But hopefully we get something done so we have that one call system for air medical. Other than that, I'd be happy to answer any questions anybody has.
And you guys are both coming to, or at least I hope you both are coming to our next fire chiefs meeting to talk a little bit about the one call system and kind of give us a NOTS update. Is that still on, Todd?
Yeah, May 27th, I believe myself and Dr. Tinkoff are planning to attend.
Okay, great. So the fire chiefs in the group will be able to learn a little bit more what the one call system is and how it could benefit us. And, so we appreciate that. And I appreciate you working on that PTSD too. I mean, I know it's becoming an issue, even this COVID stuff. I don't know if it's 100% connected, but we've had some, folks that have had some, that had COVID that maybe had some, disorders or psychological type issues post-COVID. And so as chiefs and as medical folks, we got to really keep our eye on this. So anything we can get for tools in our toolbox to do a better job for our personnel, we should be doing it. So I appreciate you working on that component. I think it is a hot topic right now for many reasons. But you just mentioned a couple of them. With Lake County folks. So, I think it's the right time to really hammer this home and get some of that information out. So that'll be great.
I'll let you know when that's ready, Chief.
Okay. Anybody have any questions? One more thing on NOTS. If you guys was at the NOTS Symposium last year and you kind of saying, it's virtual, I'm kind of done with this. That was pretty early on in this whole electronic thing, and it was outstanding. It was outstanding the way it was organized, how things flowed. I was very impressed last year with the virtual NOTS and look forward to doing it again. So you guys did a great job last time, and I would expect you guys to do the same this time around too. So good job with that.
Thanks, Chief.
Any questions for Todd?
No questions, no worries, Todd. You get back to me when you can.
I'm going to let the hospitals, I know I see Bill Sillison, there's, I know Dr. Collins. If there's any update from any of your systems that you would like to speak on, now would be a good time to update. I don't know if there's anybody from UH on or not. I know Danny was invited, but I'm not sure if he's on or not. Any updates?
Bruce, this is Bill. Nothing really from the Cleveland Clinic. It's kind of status quo.
That's a good thing, Bill.
Yeah, it is.
All right. Jackie, Jackie Casa, I guess there's probably nothing to report for the EMD subcommittee at this point.
Yeah, it's on my list of projects to pick back up this year.
Yeah, it's all right.
It's still on the radar.
Okay, I'm going to go on to old business. I kind of spoke on it just a little bit, just kind of give you one more piece of information. So we do have a large supply of MCI trailer stuff. It's in my conference room, matter of fact. Once I get those hemostatic dressings, I'm gonna make arrangements to get the equipment out to the MCI trailers. The three counties that participated was Cuyahoga County, Geauga County, and Lorain County. So I have equipment for all three of their MCI trailers. Basically, it's the expired equipment that, you know, such as chest seals and stopcocks and, you know, catheters and stuff like that that has an expiration date is what we got replaced. It is the intention to use the old equipment for training purposes, such as the RTF training that Brian Kloss is constantly hitting us with. You know, I think that will be good information, good stuff to maybe donate his way, you know, to work with our folks in doing some training. So we will be updating the MCI trailers. Currently, our MCI trailer in the county is located at Brecksville Fire Department. There is going to be some discussions about possibly moving it to the airport. And I know Nicole has one too, I believe, right, Nicole, somewhere in Cleveland?
Yes.
Okay, so I think we have two MCI trailers in the county, one in Cleveland and one for the county. So we will be, so we have those two trailers. So we're looking at that. I have no other old business. Does anybody else have any old business they'd like to discuss? All right, I'm gonna shoot up to new business. I know in recent years, we usually take in a recess during the summer months. Even some of our fire chiefs organizations take a recess unless there was something pressing going on. So I would say I would like to make a motion to skip our July 12th meeting. Unless there's some other pressing issue, if there is some grant funding coming out, we will meet. So we'll skip the July 12th meeting. We got, I made the motion and Bob seconded that. Is there feedback? I'm sorry. Is there anybody else that has a problem with that or thinks we should meet? If there's no other discussion on that, we'll skip the July 12th meeting, and our next scheduled meeting after that would be September 13th. But obviously, if something comes up and we need to meet, I'll put out a meeting notice and we can get the committee together. So, and also in that same realm, I will be looking during the summer months to put together a small working group to review our bylaws and our MCI plan. I believe last year, or 2 years ago, I worked on it with a couple of people. I think we had 3 or 4 people that looked at those types of things. So, so if you do want to look through the bylaws and also look through our MCI plan, if there's any recommended changes that you have, feel free to send them my way. We'll meet on that during the summer, and we'll report on that in September. And then if there's any changes, us as a committee will vote on those changes and implement them at that time. So take a look at those 2 things and let me know if you recommend any changes. Any other new business for the group? Any announcements? All right. So I would like to make a motion to adjourn. Do I have a second? Bob, thank you. And we are in adjournment. Thank you all for coming, and we'll see you in September. If something else comes up, I'll make sure I reach out to the committee. Thanks a lot, guys.
Thanks, Bruce. Thanks, everybody.
Thanks, Bruce.
Be safe.
Bye-bye.
Have a good week.